Someone said that she did fillers before and was severely bruised in one side. Now one side looks botched. The fillers already resolved years ago, but my side of the lip looks different. Is there any solution for that? Well, that might be a solution for that. That is something I need to assess personally and to understand exactly what happened. And this is one of the situations where I usually ask the patients if you have any pictures before the treatment. So if you can bring them to have an idea how your lips look like before you have done the fillers. And of course, there's always a way of correcting it and try to balance it. Definitely there is. And that's one of the things. These questions are really, really good. But let me focus on one thing that is very important. Nowadays, I have several people asking and calling the clinic. They want to book a consultation, but they ask if there's a free consultation. Well, I personally don't do free consultations. A consultation for me is the most important part of our journey when it comes to that, because it's when we get to know each other. It's also when people are able to bring their problems and asking for my experience and what do I need to do and what can be done for their problem, what are the options and the solutions. So usually there's a long process there, and you need to have all my attention, and I need to get all the information I can to understand what brought you to this stage and what can be done and what can be proposed in terms of treatment for that. This is even more important when we are coming for secondary procedures or for something that didn't went well in the first place. So consultations are extremely important for surgical and non-surgical, and that's why usually we have to change all this information. And so this is the only way by having it is the only way I can help you deciding which way to go, and you can help me deciding which treatment will be more suitable for you. So consultations are actually the most important part of everything, because if it doesn't go through that, anything else it's just going to be much more difficult to address and to address properly. So it takes time, and that time it's important for us to be, because at the same time when I finish the consultation, I just ask the patient in front of me is, if you don't trust me, don't do it with me. Because the same thing, if I think I don't have the abilities necessary to treat you, I won't do it. So it is a quite important part of our profession and our relation to be able to judge whatever comes.